Today, I'd like to share highlights from a recent systematic review and meta-analysis published in the British Journal of Anaesthesia, which compares two major techniques used in general anesthesia: inhalational anesthesia and total intravenous anesthesia, TIVA, including both manual infusion and target-controlled infusion, TCI. This review included 385 randomized controlled trials, analyzing data from over 55,000 patients. The primary objective was to evaluate safety, while secondary outcomes included recovery profile, postoperative complications, and costs. Let's start with safety. The rate of intraoperative adverse events, or class intragrade 3 to 4 adverse events, these are significant complications needing intervention, was statistically the same between TIVA and inhalational anesthesia. So from a safety standpoint, both techniques are equivalent, but the differences became clearer in recovery and side effects. TIVA significantly reduced postoperative nausea and vomiting, PONV, by about 50% compared to inhalational anesthesia. Emergence agitation. Patients were calmer when waking up from TIVA. However, inhalational anesthesia had faster recovery. Patients extubated sooner. They followed commands faster, reached recovery milestones more quickly. This makes inhalational anesthesia attractive for high-throughput environments like ambulatory surgery centers. When looking at TIVA delivery methods, TCI had some notable advantages over manual infusion. It significantly reduced the incidence of postoperative cognitive dysfunction. Patients had better pain control in the first 24 hours post-op. Recovery times for TCI were slightly longer than inhalational anesthesia, but not significantly worse, unlike manual TIVA, which was associated with clearly slower recovery. In terms of cost, manual TIVA was significantly more expensive than inhalational anesthesia, but TCI had comparable costs to inhalational anesthesia, suggesting that automated dosing may help optimize drug use and reduce waste. Length of stay in the PACU, ICU, or hospital overall showed no major differences between the groups. However, TIVA, particularly manual infusion, had a slightly shorter PACU stay in some subgroups. Patient and surgeon satisfaction showed no significant difference overall, though detailed subgroup data was limited. A final note on environmental impact: though not deeply studied in this review, prior evidence supports that TIVA, especially TCI, produces far fewer greenhouse gas emissions than volatile inhalational agents. This is increasingly important as healthcare systems aim for sustainability. In summary, TIVA and inhalational anesthesia are equally safe. TIVA, especially via TCI, reduces PONV, emergence agitation, and POCD. Inhalational anesthesia enables faster recovery and is more cost-effective, unless TIVA is delivered using TCI. Both techniques are valid, and the choice should be tailored to patient needs, procedure type, and even environmental or economic considerations.